Assalamu alaikum, dear doctors. How are you? I am Dr. Azhar. Today I am here with a new topic for MRCGP South Asia International. My new topic is smoking in pregnancy. Dear doctors, this is a very long topic and it is 80% about counseling. So when you see this topic in your exam, please become conscious and already keep in your mind that you have to take a brief history other than routine history. I will tell you 2 3 points also, but in this case, 5 A's. 5 A's: ask, advise, assess, assist, arrange. These are 5 A's. Ask mean history, and other A's, you will assist in quitting smoking, arrange for the patient how to quit smoking, advices which you will give, and assessment, you will assess about antenatal what position is going. But I will also do quickly few points about history, because counseling is very long. In this case, it will take 4 minutes at least for me to explain to you. Now, what history is very specific for you, uh, other than antenatal, other than family history, long-standing illness, psychosocial, and history about smoking. Few points I will tell you now, which please don't forget. Those points are socio-economic status of the patient, marital status of the patient, level of education of the patient, things at home, things at job if she is doing some job. Please don't forget these 5 things when you are asking history. Today I will, after summarization and explanation, and now I will tell you how you will convince a patient. It have some steps. First, you will ask the patient, do you know what smoking do with your baby? Of course, she will say no. Then you will tell her that today I will tell you the mechanism how smoking affects the babies during pregnancy. When you smoke, there is one gas, we say it, carbon monoxide. It goes into your blood. Then from your blood, through a big blood pipe, we say it, umbilical cord, which is attached with the baby. Through this blood pipe, carbon monoxide go to the body of the baby. When carbon monoxide will go in the body of the baby, it will replace oxygen, and the baby will have low oxygen than needed. This is a mechanism how smoking affects the baby. And then what will happen to the baby? When the oxygen level of the baby become low, the heart rate of the baby will increase to fulfill the needs of the oxygen to the body of the baby. This is the first effect. And heart rate, when it increase, it is not good for the health of the baby. And because oxygen is less in the body of the baby, so the growth of the organs and tissues of the body and bones will not be proper. So first effects, which we will say, low birth weight. When baby will born, the weight will be less. This is the mechanism how smoking affects the baby. And when birth weight will be less, what will happen? Baby will get in his life infections more than the normal babies. And there is one disease, sudden infant death syndrome. chances of this disease become more, and the baby can have more chances of respiratory diseases of the lungs like asthma. And the what other effects of the smoking on pregnancy or baby? There are more chances of having miscarriage, and there are more chances of having stillbirth, and there are more chances of having hemorrhage before delivery, and 60% chances are more than a normal pregnancy of preterm baby born before time. Now these are the effects of smoking on pregnancy and baby. So I will offer you to quit smoking, because smoking have so many bad effects. The patient can say you that I will reduce the number of cigarettes per day. Then you will advise her that reducing the number of cigarettes will have no benefits. Even 1 or 2 cigarettes per day can have the same effects on the baby when you are smoking more than that. This is the convincing. After convincing, please, as I told in my last lecture, don't forget to give pamphlets about smoking cessation. Refer the patient to smoking cessation clinic. Discuss the options of medicine, because there is only one medicine which the pregnant woman can take, that is nicotine replacement therapy. And refer to the self-help groups, sport groups. If socio-economic conditions is not good, then refer to sport group also. And give early appointment to discuss again, because the smokers, first time when they make a determination that they will not smoke, then they will quit smoking maybe, and then they can start again. So keep in touch with the patient, give appointments, and do safety netting about pregnancy, and also discuss with her the good hospital for antenatal and delivery. That's all for this case. So I hope you understand my today lecture. This is very important lecture. Please see this video again to memorize the things which I told you to convince the patient. Thank you, doctors. Next time I will come with a new topic, and I hope you are understanding me.